We are doing lower extremity liposuction for lipedema today. Wonderful patient. She's in excellent shape. She actually weighs only 110 pounds. So that's another proof that lipedema does not affect only overweight people. So she's on her feet a lot, and she developed symptoms of heaviness, swelling in her legs, and she always had bigger legs. So we are done with the first part of the procedure, which is getting the patient numbed up. We're using a lymphatic sparing Tumescent technique. This is a solution that gets injected under the skin. There's a little poke that's made in the skin, tiny, less than 2 mm poke, and we inject this fluid in the subcutaneous tissues and in the fat to numb everything up. It also contains adrenaline or epinephrine to shrink the vessels. That's why you see that the leg is a little pale. And we also add what's called tranexamic acid to minimize the amount of bruising. It's like a topical hemostatic agent that helps to minimize the amount of bruising and leakage from the incisions after the procedure. The fluid is already injected. The patient is very comfortable. She's awake. She's all numbed up, and now we're going to proceed with the fat extraction part, with the actual lymphatic sparing liposuction part of the procedure. So we're about to start the liposuction procedure. We're going to use this power-assisted tool that vibrates very rapidly, around 6,000 times a minute, and it helps to extract fat in a more efficient manner without creating too much grooves or irregularities. This patient has this typical appearance for the lymphedema where she has excessive fat pads in the lower portion of her knees and right below the knee, the typical fat pad around the knee. The patients are frequently bothered by it. Lipedema patients frequently have excess fat on the medial portion of the knee as well, sometimes above, so it's not uncommon for them to complain that they've never seen their knees. We're gonna help this patient to improve that. And also, obviously, she has a very poor definition of her ankles, what's called cankles. There's excess fat deposits on the medial and outer portion of her ankles. And before the infiltration, you could see appearance of a little bracelet with the sparing of your feet. That's typical for lipedema, that your feet are actually spared from the swelling, and it primarily affects the lower leg without involvement of the feet. We make it comfortable with a little bit of a laughing gas. It helps to take their mind off, and they can also fall asleep. This makes the time go faster. The patient frequently moves to allow us to do 360, because we're doing 360 liposuction all around to get a better definition of the calf, lower legs. And that helped also with the skin shrinkage, helped to redistribute the skin. So excess skin is actually never a problem for the liposuction below the knee. And even in a very advanced stage 3 or 4 lipedema cases, the skin usually responds very favorably and shrinks quite well. Right now we're working along the tibial plateau to highlight that little bone with tibia. When the patient turns, we're going to work on the back portion of your leg to highlight those calf muscles. Usually after this procedure, the patient can see their calf muscles first time in their life, and we're very pleased with that, majority of them. Liposuction will help quite a bit with the swelling, with the discomfort, with the heaviness in the legs, but as I always tell my patients, it does not cure lipedema. There's no cure. It's a genetic mutation that affects about 10% of the women worldwide, where we have too much progesterone in the fat tissue. And we cannot fix that with the liposuction, but we can definitely make the symptoms much better. We just completed the right leg, so I'll show you the difference. Even though the patient is so skinny, we got quite a bit of fat. You can see in the bucket there, about 400 cc's of fluid mixed with a little bit of blood, and the rest is fat. So around 800 cc's of fat came out just from this skinny leg. And you can see it has the outline of your calf muscle. And you can compare left leg versus the right one. You can see a great difference. This is the left leg, so we haven't done anything there yet. And this is the right leg from behind. You can see much better outline of your calf muscles, your gastroc muscle. You can see your Achilles tendon, and just overall the leg looks much skinnier than before. This is the immediate result. We are done with the liposuction on both sides. And so just tiny little pokes. When they heal up like little dots, so you can't really see them very well. Sometimes I have to make extra incisions if I need to get to certain places, but I was able to achieve good result, just one incision on each side. You can see better definition of your, and this is swollen, remember there's a numbing fluid in there. Better definition of your Achilles tendon, better definition of your calves. This is much more slender, and we try to keep it as smooth as possible. I use a special technique to redistribute the fat at the end. I think it's going to be a great result for her. She's going to be happy. Nice. Oh, that's beautiful.
See.
Looking good.
Unbelievable.
Nice.